Hi everyone! Welcome back to our YouTube channel. This is Amanda Brewer with Brewer Physical Therapy, and today we're going to discuss a method for relieving low back pain, which is called the McKenzie Low Back Pain series. If you have low back pain, you are not alone. Most people in their lifetime experience one or more episodes of low back pain. In most cases, the pain goes away within days to weeks. However, it can sometimes last for 3 months or more. These extended episodes are often defined as chronic low back pain. The common treatment approaches for low back pain include exercises, relaxation techniques, and medications. To understand how these treatments work, let's first look at the structure of your lower back. The spinal column is made up of 24 vertebrae. Back problems and back pain commonly occur in the lumbar region. Each vertebrae has an opening that forms the spinal canal and protects the spinal nerves. Facet joints and intervertebral disc connect the vertebrae above and below. These structures are held together by groups of ligaments and muscles. Muscles attached to the spinal column allow us to move, and they also support the spine bearing the body's weight. If some of these muscles are tight, weak, or imbalanced, pressure can result in excessive wear and tear of other structures. For example, a common problem in the lower back is disc herniation. In this case, pressure on an intervertebral disc has caused its center, the nucleus pulposus, to protrude backwards and push against the spinal nerves, resulting in low back pain. For some patients, the pain can also be felt in nearby areas where the spinal nerves from the lower back also extend, such as the leg and foot on the affected side. Exercise can relax muscles and reduce pressure in the lower back structures. It is important to consult with your health team to determine which exercises are best for your condition. Consider one common low back pain exercise program called the McKenzie Method. For patients with posterior disc herniation, lying in a prone position reduces the pressure on the disc. If the pain condition allows, performing extension movements can gently stretch and relax tight muscles. Your lower spine also becomes more arched with time, bringing the disc center forward into the correct position and reducing the irritation on your nerves, therefore decreasing the pain in your lower back and legs. The benefit of exercising is more than just reducing the pressure on your lower back structures. By integrating back exercise into your daily routine, you can condition your abdominal and back muscles, referred to as core muscles, and therefore prevent low back pain from happening again. For some patients, relaxation techniques such as meditating in a relaxed position, as well as cognitive behavioral therapy, can ease back pain. This is because our brain not only perceives pain, but also regulates pain signals. When back structures are damaged, pain signals ascend from the lower back through the spinal cord. They arrive in the brain region that perceives pain, the sensory cortex. However, this is not a direct route. At least 2 connections have to be made. It's at these relay stations, which include the spinal cord and the thalamus, that pain signals can be regulated by the brain. Let's take a closer look at the first relay station, located in the dorsal horn of the lumbar spinal cord. Here, the incoming pain signals are passed from a sensory neuron in the lower back to a relay neuron in the spinal cord. The pain signals then ascend up to the brain. This pain impulse can be reduced by a specific type of neuron carrying signals back from the brain. As a result, fewer pain signals are sent to the brain, so we feel less pain. However, if, for instance, you are stressed, these brain signals can increase the pain signals. Therefore, studies show that patients with depression or anxiety experienced more pain, while patients who have positive attitudes and are engaged in their treatment feel less pain. Your health professional may also suggest that you take pain-relieving medications that fit with your existing medication regimen. The effects vary greatly depending on what type of medication is prescribed. Some medications help relax muscles, and some act on the neurons in the relay stations to reduce the pain signals. It is important to follow the advice of your health team and do exercises, learn relaxation techniques, and perhaps take medications as a last resort. The benefits might not be felt right away. It takes time and your active participation. Our Brewer PT app can help you play an active role in your recovery. By taking an active and informed role in your own health, you are guaranteed to better control your pain and lead a better quality of life. Now it's time to review the McKenzie Method for low back pain in a little more detail. Please consult with your physical therapist prior to commencing these exercises. This method of exercises to relieve low back pain will not improve all types of low back pain, and in certain circumstances may cause worsening of symptoms. Indications for the McKenzie Low Back Pain method may be if you are experiencing pain from your back which is radiating to your leg, sometimes referred to as sciatica, bulging disc, pinched nerve, herniated disc, or slipped disc symptoms. Do not attempt to perform any of these exercises if they cause pain to extend further down your leg. If you experience increased leg pain, numbness, or tingling, stop and make note of it. This is called peripheralization. Contact your trusted physical therapy provider. Do not perform these exercises if you have been diagnosed with an anterior disc bulge, a spondylolisthesis, or another serious spinal condition. Expectations. You should feel decreased pain in your leg and possibly an increased sensation of symptoms in your low back. This is called centralization of symptoms. The first exercise in the McKenzie series is called prone lying. You will lie face down with your arms beside your body and your head turned to one side. Take a few deep breaths and relax in this position, focusing on removing the tension from the muscles in your lower back. Stay in this position for 5 to 10 minutes and repeat as directed. Exercise 2 in this series is called prone on elbows. You will bring your arms up and place your elbows under your shoulders so that you are propped up on your forearms. Once in this position, take a few deep breaths and then allow the muscles in your low back to relax completely. You will remain in this position for 5 minutes. Exercise 3 is called prone press-ups. For this exercise, you will lie face down with your arms beside your body and your head turned to one side. Bring your arms up and place your hands underneath your shoulders. Straighten your elbows and push your top half up as far as the pain permits. Remember to keep the pelvis, hips, and legs limp and allow your lower back to sag. You will hold each press up for 1 to 2 seconds and then lower to the starting position. Try to raise yourself up a bit further with each repetition. Repeat as directed. We recommend performing this exercise 2 sets of 10 reps. Exercise 4 is called standing extension. Generally, this exercise is used if you cannot get down onto the floor to perform exercises 1 through 3 in a series due to being at work or not having a surface that is clean for you to lay down on. For exercise 4, you will stand with your feet slightly apart. Place both hands in the small of your back with your fingers pointing backward. Bend your trunk backward at the waist as far as you can, using your hands as a fulcrum. Keep the knees straight as you do this. Hold for 1 to 2 seconds and return to the starting position. Try to bend back a bit further with each repetition. Repeat as directed. Generally, we recommend 2 sets of 10 repetitions. In review, exercises 1 through 3 are performed in a series. They are performed every 2 hours that you are awake, which is usually about 6 to 8 times per day. Exercise 4 is often used as a substitute for exercises 1 through 3 when they cannot be performed. To reap the full benefits of the McKenzie Method, it's best to work with your physical therapist who can give you a proper evaluation. Still, you can try a few McKenzie exercises at home for back pain relief. Contact our office if you require further guidance with the McKenzie Low Back Pain Method.